Hi, my name is Chip and I'm a paramedic instructor in North Carolina. I'm here today to tell you a little bit about on how to treat a heat stroke. A heat stroke is the dire heat emergency. Heat stroke victims typically are unconscious or near unconscious, and typically their sweating has stopped. They've gone through the initial heat stroke phases, such as the first phase before you get to heat stroke is you're going to be a little weak and dizzy. You're sweating a whole lot. You get some heat cramps. Your muscles start to tighten up. If you don't drink a lot of electrolytes and water fluids or get in the shade, you'll start having what's called heat exhaustion, which is when you get very, very tired. You're exhausted from the heat. You're still sweating. You're nauseated. You start vomiting. And if you continue not to get in air conditioning or drink a lot of electrolyte type fluids and water, then you'll end up in a heat stroke. Heat stroke, your body cannot sweat anymore. So typically they'll be dry. As far as the sweating goes, their skin will be very hot to the touch, red, but it won't be a sunburn typically. And again, they'll have altered mental status, they'll be confused, or they'll be unconscious. This is a life threat. Someone can die from this very quickly. What we need to do for these individuals is, number one, get them out of the hot area, get them into an air-conditioned building, or if that's not available, at least get them into a shaded area and maybe have someone start to fan them off. We need to remove any clothing that's on them as quick as we can. If we have some water, we can pour it directly on them, or we can put it on towels and things. Cover the patient. We want to try to cool them down. If you have the commercial cold compresses that are chemical activated, we can activate those. Put them in armpits. Or if you have ice, maybe there's a cooler around, you can put it in bags, wrap it in towels. Again, armpits, the groin area. What we're trying to do is we're trying to cool down the body as quickly as we can. And these areas, the neck, the armpits, and the groin, they all have major blood vessels running relatively close to the surface of the skin. And so we can help cool down some of that blood flow. 911 needs to be called again immediately. This is a life-death situation. So make sure that when you do, you tell them what's going on. Again, keep them cool down. Fan them as best you can. When they're wet like that, you can fan them. That'll help cool the body down quicker. Your ice packs, whether it's commercial available or just ice in a bag. Again, sides of the groin, armpits, shoulders. Make sure you don't cover the entire neck because you can cause some airway and blood flow problems there, so you might want to stay away from that area. Maybe the shoulder area would be a better location. And also try to make sure that the patient's airway is open. Make sure that they're able to breathe. Hopefully you're certified in CPR. If not, I would recommend you would do so. And again, make sure you cool them off the best you can and call 911. Thanks, and this is Chip, and I hope you've learned something about how to treat a heat stroke.